Hello Facebook, I'm glad you guys are there too. I know I can't always look at my Facebook colleagues out there because I'm looking at two different cameras, so if it looks funny during some of the time it's because you can't put all four formats that we broadcast on one particular camera system, so my apologies if I'm not always looking at you while I'm chatting, but I'm thinking of you all the time. Hey Doc, right back at you. Nick, I'm going to talk about that. That's a great question, and we're going to address that tonight, I promise. In fact, it's everybody, not just those in the healthcare field, so we'll chat about that shortly. Okay, so while we're waiting for everybody to sign on, welcome back to Fertility Fact or Fiction. We've been doing this for, what's it been now, about 3 or 4 months?
Yeah, we've been doing it.
We've been doing it for a while. It's starting to grow. You got to bring friends. We need you guys to help us grow, so make sure you invite your friends, tell everyone, subscribe. We need you to subscribe on YouTube, on Instagram, on Facebook, on Twitter. And you can even click the little bell, and that way every time we're doing it, and it'll probably be more frequent in the coming weeks as COVID-19 sort of evolves. We definitely want to be doing live shows for you guys and answering all your questions. So make sure you subscribe, tons of likes, that helps us grow as well. But bring a friend. Every time you're coming, bring a friend. We want to try and exponentially grow this so we can get the information out to people. So help us make it happen. Thank you for missing me. I missed you right back. Okay, so I need kind of a show of support here for either do the regular Fertility Fact or Fiction, and I'll take 10 or 15 minutes to go over the very interesting topic tonight, or do you want me to just address COVID-19? So, what do you guys want me to do?
Get a whole bunch of likes. Or
Yeah.
thumbs up for.
Okay, so let's go with a whole bunch of likes for those who want just COVID-19. I don't think we have that many people signed in yet. I got 1 like. Oh, 2. 3. All right, everybody wants COVID-19. Oh, here they go. They're firing off. Okay, so you guys, all right, I get it. We're good. Address COVID-19, just COVID. Okay, someone said Clovid. I love it. All right. Okay, guys, so tonight, was going to be whether or not letrozole helps in frozen embryo transfer cycles, and I'm going to leave that till next time. We're going to shelf it for now, and we are going to address all your questions about COVID-19. So let me begin with the basics. COVID-19 is a viral infection, and it is a virus that is common in terms of its family. It's called coronavirus because of the fact that when you look at it under an electron microscope, it looks like it has a crown. So the virus that has come out this time is very typical, like every other virus that we get from the corona family, in the sense that it's like a common cold virus. The coronavirus has caused the common cold, and this one is not particularly different. Someone says her video keeps freezing for her on Facebook. If anyone's on Facebook, let us know if your video is freezing as well, so we can help out Autumn and figure out if it's just her or if it's everybody. So, common cold virus. The problem is this one is quite aggressive, and if you are either older or you are in any way immunocompromised, or in particular if you have issues with your lung function, this virus can be quite devastating. So the problem with the virus is, number one, it is spreading very quickly because of travel. Number 2, we did not have appropriate testing in place anywhere. And number 3, we had issues with the fact that people are constantly in close contact with one another. In all sorts of different venues, whether it's at a social place or a social gathering, in intimate locations, in stadiums, in concerts, in parks, you know, wherever it's going on. the closer and the tighter we are together, take San Francisco and New York and probably downtown Toronto and many large cities throughout the world, the faster this is going to spread through direct physical contact. So because we were all behind the 8 ball a little bit on this one, we are, having to catch up. And so right now, every government out there is hopefully doing their best to try and get everybody to come through. In terms of being pregnant with COVID-19, the answer is right now, if you are pregnant, the UK is recommending all pregnant women stop working and being exposed. So they're actually telling pregnant women that they are a high-risk group and that they should not be in a situation which risks their exposure, so you should be out. If you are talking about being around patients who are high risk, then for sure I would get out of there. If you are trying to get pregnant, they are currently recommending that women stop trying to get pregnant. Not because anything is known, because to date nothing is known about outcomes because it is too quick, but they are recommending to everybody that they not try to get pregnant because of the fact that they don't know what the impact of the virus will be on pregnancy. So the current recommendation is hold off before getting pregnant. Okay, we've got some people coming back to us on Instagram. Let us know if things are better now. We should not hopefully have any more breakage. And I've got a message from someone too. Maybe, I think it's other people's internet. Once you signed in and out, you were smooth as could be.
I like smooth as could be.
I like smooth as could be too. Okay, for those of you rejoining us for the 100 millionth time, thumbs up if it's going well and thumbs down. Okay, everybody's giving thumbs up. Okay, sorry guys, I don't know what's going on. I think there are literally billions of people on the internet all over the place, and so that's probably the problem. I'm tethering off of my cell phone now. Okay, so the question was, should I be working in a healthcare environment in the presence of COVID-19? And the answer is, right now in Canada and in the US, no one has said anything different from what we've known before. But in the UK, as you probably would have seen from my Instagram post, if you are currently pregnant, you should stop working and sequester at home. That's what they're saying in the UK. They have designated pregnant women as high risk. And because of that, you're supposed to stop working and be sequestered. So in-home, self-isolation, stay away from everybody else, and don't be going out anywhere unless you absolutely have to. This makes sense for a variety of reasons, and I'll go through those with you. Number one, we know that the greatest impact of the COVID virus in terms of its negative impact on people is respiratory, meaning your lungs. So if you're going to get sick from this, it's because it's going to impact your lung function. That's why the problem is that we need so many ventilators and people on ventilators. So as a result of that, we really need people to be super, super careful with their lung function. Pregnant women have decreased lung function because your uterus starts to grow, it pushes up into your diaphragm, it decreases your pulmonary volume because you can't take as deep a breath. So you can't do that because your diaphragm literally hits your uterus and it kind of bottoms out. So because of that, your lung function is generally somewhat compromised when you're pregnant. That's why a lot of women feel shortness of breath. And that's why when we had the H1N1 virus, we had a lot of women that were in the ICU with respiratory illness while they were pregnant because of the fact that their lung function was not ideal. So if you are a healthcare worker and you are pregnant, the UK is recommending you stop working. And so that does not yet, that has not yet been issued by Canadian or American authorities, but I think it's around the corner because you guys are the high-risk patients, and it makes sense to take care of the highest risk patients the earliest. That includes patients that are elderly, whose lung function also may be more compromised or whose immune systems are more compromised, as well as those who are pregnant and anybody else that has any kind of immunocompromise. So if you are a healthcare worker, get out of the hospital, get out of work. And I know yesterday was my obstetrics day where we saw all of our OB patients. And I, off the top of my head, say probably half of our patients stopped working yesterday. They're all too worried about it. So I think that's totally reasonable. I was more than happy to write them off. So if that includes you guys, then let us know and we will definitely do something about it. Okay, I am open to questions about COVID-19. So we addressed one already. If you are trying to conceive, will the virus affect your ability to conceive? Okay, so far we know very, very little about the impact of this virus on your ability to conceive. There was a very brief post from a physician and hospital in China which said that there may be an impact on male fertility if you are infected by the virus. However, it was very rapidly taken down because there was absolutely no science behind that claim. It was literally just a there may be, as in they didn't know if there is or there isn't. So they kind of just wanted to let people know this could be a problem, but no one knows if it's a problem or not. So we do not know for men if there is a problem with the sperm production, with sperm output, with sperm quality, quantity, anything like that. We really do not know. So that very brief social media post from that Chinese hospital was subsequently taken down because there is no scientific proof yet that has any impact on your fertility. I can tell you that to the best of my knowledge, there is no evidence as of yet that any of the coronaviruses ever impact fertility, or else everybody that's ever had a common cold would be infertile, and clearly that is not the case since pretty much all of us have had a common cold. So I don't think that that's gonna be the case here, but certainly we don't know yet. In regards to women, there is no proof yet that the coronavirus is impacting people's ability to get pregnant, but again, we are dealing with a very short window of exposure so far. We do not know what kind of outcomes that will have. No one has even looked at that yet. So I would love to answer that question for you. I know everybody is worried about it. The recommendation is stay safe. Hand washing, I know you're probably bored to death of hearing people say hand washing, but hand washing, stay away from areas where there are crowds, do not come into contact with large groups of people. Those of you who are pregnant, unfortunately, and I deeply and passionately feel for you, but cancel your baby showers, your gift-giving sessions, your social things that you're gonna do. It's really important that everybody stay safe. We need to get over this because it's not just important for the health of all the patients, this is important for the global economy as well. It is going to be as sick as the patients are, and we need to each do our part to make sure that that works out well. So stay sequestered. This is just a brief period of time if we all do our job, and if we do it well, we can overcome this quickly and get back to life as normal as quickly as possible. My name is Mabel. Hi, Mabel. Should we cancel an FET cycle that's scheduled for tomorrow? Wow. My doctor called saying that the reproductive fertility industry from the US would leak a document that said something about the relation of COVID-19 to pregnancy. Okay, so if you are petrified, if you are terrified, if you are anxious about the virus, it's going to have a negative impact on your success. I'm not actually worried about your chances of getting the virus because the infection rate is extremely low. Right now, I think it's 1 in 100,000 or 1 in 10,000, but very, very low. So we're not worried about you guys getting the virus. We're worried about your success rate, and then we're worried about what will happen to you if you are pregnant and you then get the virus. So that's the concern with doing embryo transfers. No one's concerned about your exposure from the fertility clinic. That's probably very unlikely because we're all screening before we let patients in, but we are very worried about the potential for you to end up having virus while you're pregnant. As I mentioned, it can compromise lung function. You're not more susceptible to it if you're pregnant, pregnant, you're equally susceptible to it if you're pregnant, but that susceptibility can carry a heightened sense of danger if you get lung compromise. So that's why we worry about it. As far as canceling one for tomorrow, I mean, I can't decide for you if you should cancel for tomorrow, but most of the fertility societies are currently recommending that all fertility treatments be stopped. That is both the American Society of Reproductive Medicine and the Canadian Fertility and Andrology Society. I have not seen a statement from ESHRE, which is the European Society of Reproductive Hormones and Endocrinology, but I'm going to guess it says the exact same thing because they're all going to do the same thing. So currently, everybody is being told to be on standstill. For those of you that want to go ahead, again, I'm not worried about the virus affecting the transfer or the pregnancy. I'm not worried about you getting the virus at the time. If you can get in, get out, sequester, and stay safe for your pregnancy, you're probably going to be just fine. So I wouldn't encourage you to quit or to continue. I'm going to stay neutral on that. But I do need you to make sure that you understand that the risks of you contracting the virus from showing up at a fertility center are minimal, very, very minimal, especially if they're screening you. Any of you who tried to come into our office know that there are in duplicate signs on the door in bright, like fluorescent orange, basically saying do not enter if you're sick. And once you enter the first sort of reception area, as soon as you cross the threshold, someone is asking you again if you've had any of those symptoms, and if you have, we're not letting you in. So we're keeping the place clear and safe, but we need to make sure that you guys understand that's not the risk. The risk is what's going to happen to you if you contract the virus while you're pregnant.
I think even if you touch on the mental part of it, that'll be so sad.
Yeah, and as I mentioned, Tarek is just so again, and I started with that. If this is stressing you, which understandably, I think the whole world is currently stressed. If this is making you anxious, if you are worried, if you are deeply concerned, if this is bringing you to tears, if you have family members that are affected, or you can't even see your family members. My own daughter came home from Scotland. I have not seen her in 3 months, and I cannot come within 6 feet of her, and she's currently in our basement, unable to come upstairs or give us a hug or a kiss. And I love you, Jenny, if you're watching, because of the fact that she was overseas and we have to isolate her for 14 days. So, even though she's home with us now, right before they close the borders, I can't get near her because of this. So, for those of you that are suffering and it's bringing you some mental anguish, then don't go through with any kind of fertility treatment because it's not going to work. It's a 60% reduction in any kind of fertility success when you are stressed. So if you are stressed, don't go through with it, wait. You are much better off waiting. For the Mabel patient that has an FET planned for tomorrow, you got to find a way to get a hold of your center before tomorrow morning, or bright and early tomorrow morning, because probably at 5 or 6 in the morning, they're gonna thaw your embryo, and once it's thawed, it has to go in. So keep that in mind, or start emailing like crazy to see if you can get a response. And I wish you all the very best with that. Hopefully it works out the way it's supposed to work out. Okay, I'm flipping back to Instagram. Instagram, YouTube, Twitter, sorry, I think there's internet overload, and I don't think it's on our end. I think it was probably on yours, but we'll go through it and see. Okay, feel free to ask questions, guys. We're skipping the fact or fiction. We are going straight through to answering COVID-19 questions tonight. So are all fertility treatments suspended at your clinic until further notice? Example, IUI procedures. Not yet, because it has not been issued by any Canadian authorities. We're actually unsure if fertility care is considered essential or not. I suspect they're going to say no, and so we're going to get some clarification on that as quickly as we can. We are still doing the visits by phone or video or in person if necessary. As an OBGYN, I can't just close the doors. I have a fiduciary responsibility to take care of all of you guys. So We are not closing the doors. I will be here every day seeing patients. We will take every precaution to protect you, and clearly every precaution to protect us. That includes wiping down every surface after a patient leaves. That includes my washing my hands more times than I care to count. My hands are like bone dry now. And doing everything we possibly can to keep the place clear and clean, and extensive screening when you come through the door. If you are coming in here into Victory Reproductive Care, you cannot enter if you have been sick, are sick, or have been in contact with someone that has been sick. So do not come in. We will not let you in. It's nothing personal, guys. These are the precautions we have to take to protect everybody. So we're still going ahead. Keep in mind, anybody that is starting will likely not be getting their fertility treatment until several weeks from now. The anticipation is that by that time we will be over the hump and we should be in the clear. So hopefully that answers that question. Will this push your opening timeline for your IVF clinic? Yes. So the College of Physicians and Surgeons issued a notice saying all assessments are being stopped because of this. I have yet to reach out to them. That was just issued yesterday, but we are expecting some delay. We will probably be able to do embryo transfers very soon. That's not sort of mandated by the college, so that's okay, or regulated, I should say, by the college. But in terms of doing egg retrievals, there will probably be a brief delay before we can get that up and running. I have laparoscopy booked with you next week. Should I reschedule? I'm coming from Sarnia. The hospital here just canceled most surgeries. All elective surgeries across Canada have been canceled. No one is getting operated on unless they have an immediate need, a life or death situation, or it's a cancer case. Aside from that, then nobody is getting surgery. So everybody's OR is canceled until further notice. That's true for every service. Only life and limb, or something that's absolutely requiring treatment right away. Like I said, an example would be cancer. I did do a surgery today. It was for a woman who had a big pelvic mass and an ovarian torsion. That sort of thing we're still allowed to do. We've had a request for a D&C, obviously, for miscarriages and so on. We can still do those. But if you have elective surgery because we're trying to figure out what's going on inside you, that is now canceled until further notice. This is to keep the hospitals clean and to keep the resources available so that in the event that we have large numbers of people coming, that we are able to deal with that. So I'm very, very sorry about that, but that's the reality right now. We will get back to you as soon as we know when we are able to do the surgeries. The first chance they tell us, we will move forward with rebooking everybody. I need you all to give a thumbs up and a big, huge like and love for Mara Menard, world's greatest office manager who books all of your surgeries. She's the most incredible person I know, and all of this is going to fall on her shoulders. So Mara, we love you, and I will somehow make this up to you whatever way that I can. We'll get her lots and lots of flowers, and I will find a way to send you on some kind of holiday after this, because God knows you're going to deserve it. And all the girls here as well have been suffering through this, so thank you to my team at the Windsor site and the Sarnia site, to both of you, and to our wonderful nurses at my former center. I love you guys too. Stay strong, and I hope that you guys are staying safe and you are well. I know at least one of you is watching, so I hope you're doing well. Okay, I think I know the answer, but do you want to take Crinone until you get a positive pregnancy test, or is it after ovulation? I can't remember from our appointment. Take Crinone until you're 36 weeks, but after 12 weeks you can take one once a day instead of two once a day, one twice a day. So at the 12-week mark you can cut down. The reason I recommend to patients that they take Crinone all the way to 36 weeks is because progesterone does reduce your chances of preterm labor, and there are risks of preterm labor when you're a fertility patient. Okay. Had our first appointment with you Saturday. My husband and I are supposed to start our testing this month to figure out what's going on. Should we continue with the testing or wait until this virus is under control so you can focus on patients that are already pregnant? No, we manage our OB day in one day, so you can continue with your testing. We are going to stay open for testing for now until we're advised otherwise. So it's kind of almost business as usual, but like super safe business as usual. So we will space you out. Everything has to get cleaned down. I gotta basically wipe everything down to make sure no one's getting any kind of contamination. Door handles, seats, benches, beds. The ultrasounds are obviously all getting, treated appropriately with sterilization equipment. And that stuff will kill anything. It burned a hole through a shoe once. So it's pretty aggressive stuff. Okay, so no, you can come on in. I want to make sure I'm not missing anybody on Insta. Being a nurse in Windsor, Essex at the hospital and being pregnant, would it be wise to take it day by day? Hi, sweetie. Stop working. Don't be conflicted. The UK has already done this. I answered this earlier in the show. If you are in healthcare and you are pregnant, just call us. You don't even need to come in. It's not worth the exposure. Call us. We will fax the letter to wherever it needs to be faxed to, so there is no need for you to come in. And we will get that letter out. You should not be working if you're pregnant and you're in healthcare. Stop working. We need to protect you guys, and that's the right thing to do. I don't want to be behind the 8 ball. I'd rather be ahead of it so that we don't have to worry, and I want to make sure that we take care of our pregnant women. You guys are obviously one of the most precious resources out there, and we do not want to take any chances. Why wait until we find out there could be a problem? Let's take care of you now and get you out of harm's way. So yesterday, pretty much anybody that said they wanted to go off, I told them I don't know if it's a benefit or not. So if they wanted to, we said yes. Subsequent to that, the UK issued that guideline last evening, including pregnant women as a high-risk category, so go off. And again, reach out to us and we will write you off. Okay, lots of thumbs up. I guess that means everybody is saying it. Mara rules. Mara does rule. I agree. That's literal and figurative, actually, because she's the boss here. Mara, if you're watching, everybody says they love you. Are you able to go into more detail about embryo transfers? I think I just heard you say that you are still able to do them. Are you starting to book dates at Create for embryo transfers? Well, I was, and I spoke with Dr. Liebrecht, the main guy at Create and the owner of Create, and he said that it was still business as usual there. So we are still planning to proceed. Having said that, that was before Trudeau shut down the entire country. So I don't really know if fertility care is considered an essential service or not. And if it is an essential service, then that's great. We can continue. And I'm certainly happy to travel back and forth, even by car if necessary, to take care of you all. But if it is not an essential service, there are penalties for staying open. I'm certainly not going to speak for Dr. Liebrecht, but I know that at least one fertility center, one of the larger ones, has closed, and that's the Ottawa Fertility Center until further notice. So it really depends on a case-by-case basis, and I think this is evolving day by day based on the recommendations. Someone is saying that they love us, so I love you right back. Thank you. You guys are amazing. Okay. So are we stopping IVF transfers due to that recommendation? Yeah, so I guess everybody's asking the same thing. Yeah, I think for now we are not stopping, we are pausing. With some luck, this hump of this will be over in 2 to 3 weeks, and we can get people started now and prepare them for the time after that. But at present, I think you have to take it day by day, and until I am told otherwise, we are certainly getting the lab ready here. Everything is going to be finished by tomorrow. Liquid nitrogen arrives by Friday, and then our embryologist is coming Monday to start making sure that all the equipment is functioning the way that it should be, and to test it with the appropriate testing materials. So we are planning to proceed. It will take a couple of weeks for us to be ready anyways, so we are hoping that this times out perfectly for everyone. If you're talking about create, I need to reach out to Dr. Liebrak, and I'm going to do that during normal working hours because I am sure that the poor man is inundated by 18 million text messages, emails, and phone calls, because he runs a ginormous program, and when you have 3,000 patients per year and you've been doing it for many, many years, there's a lot of people to answer to. So I will text him tomorrow, and I will probably post it so that you all know. So hopefully that'll answer it for you. You are all in good hands. Thank you, Dr. Victory. Without you, I wouldn't have my daughter. Aw, thank you. That's very sweet of you to say. You know, it's those bright spots in the middle of this torrent of crazy that are going to help us all get through this. So stay strong, share the love, make sure everybody is, you know, getting lots of positive vibes and positive affirmations. I know it's hard. I know this is very, very challenging. We do want to be here for you, for your mental health. As you know, and I talk about it every episode, we have enormous resources available to you, and they can mostly be done online. We actually have an online program, Organic Conceptions, fantastic program. It is free to all of you, so if you're stressed, you can use that program. We have Brenda Davies, our incredible psychologist. We have Darcy, who's our amazing social worker. Dr. Carrie Mayran, she could probably reach out to you via telephone as well, because thank God for the ministry. They actually came up with billing codes for doing phone consults, and I'm more than sure that she would be happy to reach out to you guys from home. So we've got resources for you. I understand that this is incredibly stressful. Even if you're not going through fertility, this is incredibly stressful. So if you need help, we are here for you. We want to take care of you. VRC is a holistic program. We're not just here to give you medications and either poke you with a catheter or a needle or anything of the sort. We are here to take care of all of you. So whether it's your mental health or whether it's your, you know, womb, we want to take care of all of it. So let us know what we can do, and we will do whatever we can to help you out. Okay. What do we currently know about effects of COVID on babies born to positive moms? Okay, so there is only one published study. It included 9 pregnant women from China. And I posted this on Instagram, so you can find it there. In that post, they demonstrated that none of the babies were infected. All of them were clear. None of them even had any virus in them or on any part of anything. So their nose was swabbed. I think their butts were swabbed. They checked the amniotic fluid. They checked the placenta. They took blood from the babies. They took blood from the moms. Like literally every possible source was checked, and none of the babies were infected. There was, however, subsequent to the publication of that study, one single report of a baby that had coronavirus shortly after birth, and the mom was infected at the time of delivery. The problem is they don't know if the baby got it during birth because it was a vaginal delivery, or if it was transmitted while in utero, and I think it's going to be awfully difficult to figure that out. However, the fact that 9 other women didn't have it makes me feel very comfortable that this was likely something that happened at the time of birth, and likely because of transmission directly from contact. So I anticipate that that's the likely source. I am guessing, and I want to be very clear that I am guessing, but most likely that's the case. It is unlikely that 9 women were fine and there was not a sign of virus anywhere on any of those babies, and then all of a sudden one came out infected. So most likely this does not cross the placenta, and that's really important. Okay. Hi, Kel. Can you speak to the importance of social distancing? I feel some people aren't taking it seriously enough, and the most vulnerable need to be protected, including pregnant women. Okay, so there is a study out I'm a science guy, you guys know that. There is a study out from Imperial College in London, and they have a COVID-19 response team. I am going to thank my son, Mattine Aaron Victory, for sharing this with me. Thanks, Matt, smartest kid I've ever seen. And he mentioned this to me, so I pulled this study. So the thing you need to know about this is that they have modeled the situation for this as to what would happen if we did nothing, including not social distancing. And let's just say that rather than scare everybody, I'm not going to give you the answer. So hopefully that'll give you enough of an indication of what the virulence and the potential for mass infection is if we do not observe social distancing. Social distancing basically means don't hug and kiss, don't shake hands, don't get into each other's personal spaces. They're recommending a minimum of 6 feet, and now I'm hearing 10 feet. So stay away from people. Like I said earlier in the show, my daughter, who is the light of my life, is in our basement currently, won't even come within spitting distance of us. So, we definitely need to take this very seriously, guys. Just to give you an idea and to share some numbers that are accurate right now. If you are 20 to 29 years old, 1.2% of patients that get the virus, so this isn't 1.2% of people, okay? Like 1 in 10,000 to 1 in 100,000 are getting infected. But if you are one of those 1 in 10,000, let's say, 1.2% of that 1 in 10,000, so we're talking a very, very small number, will need to be hospitalized. Of that percentage, 5% will need critical care, and 0.03% will unfortunately succumb to the disease. So the numbers are very, 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 very low. So remember, you got to take 1 in 10,000, you got to multiply that by 1.2%, which is 0.012, and then you got to multiply that by 0.03. So that number is like 1 in, I think, several million by the time you calculate it out. So your chances of dying from this are low. But this is all based on a low spread. If we get a high rate of spread because people are not observing the social distancing, we're in trouble, guys. So you need to take that with the utmost seriousness. Don't get into contact with people. Obviously, if you're coming into a physician's office, I'm using gloves. I always help people off the bed, so I always give women my hand to help pull them up. I was getting them to grab my arm instead. I literally wash my hands more times than I probably washed my hands, in a week, just in one day to get every single patient safe. And I'm double doing it. So I'm washing with soap and water, and then we're also using the sanitizers. So we are taking every step to protect you, but you need to take every step to protect us and everybody else around you. So Kel, it's a great point, and I absolutely need you to make sure, everyone, that you are watching your social distancing. I think we're going to have to do another hour. There's like a million questions here. Right. Okay, if pregnant, what is the best medications to have at home just as a precaution? Tylenol is the only thing you can use. Vicks VapoRub, Hall's Candies, those are all safe. Cough syrup that says DM dextromethorphan. But if you are sick and you are pregnant, you need to go get checked out if you are really ill. Don't wait until it gets bad. Aside from that, lots of immune stimulants, garlic, vitamin D, vitamin C, echinacea, as many vitamins as you can cram into you. Healthy diet, lots of fluids. You want to stay hydrated. This virus is thought to get in through your mucous membrane, so that's your nasal passages and your oral passage. If you keep it more wet, so I'm going to chug right now, then you have a lower chance of getting the virus because moist mucous membranes function better. So lots of fluids, that's important. Stay away from caffeine because that dries you out, guys. The publication in the Lancet stated that considering the SARS-CoV-2 has up to 85% sequence similarities with SARS, Although none of our patients developed severe pneumonia or died of COVID-19, pneumonia could follow the same trends. Yeah, so I already mentioned that earlier. Basically, you are at a higher risk of developing pneumonia when you are pregnant. It doesn't matter what the pneumonia is coming from. Pregnant women are at higher risk of pneumonia because they can't expand their lungs from taking a deep breath. You need to open those little pockets called alveoli in your lung in order to avoid infection. So when you can't do that because you're pregnant, the problem you're going to run into is you are at a higher risk because there's lung collapse. When there's not oxygen going in and out of there and it's not opening, more bacteria and viruses get a chance to infect that space. So regardless of the COVID-19, all pregnant women are at a higher risk, and now that we have this virus around, you need to take extra precautions. Can I get a thumbs up to see if people want us to do an extra half hour? Likes and thumbs ups, because Instagram's going to kick us off in about 10 minutes or so, and if you want me to come back, I will. And Matt, I see that you clapped for the fact that I told you you're the smartest kid I've ever seen. Everybody's asking for another half hour. Okay, so on Facebook, I think we can continue, guys, and I will happily do so. You guys all need to give my wife and daughter a shout out because they're at home waiting for me. Yeah, everybody's asking for it. On Instagram, Twitter, and YouTube, we will end up getting kicked off. We will sign right back on for you, okay? I'll go an extra half hour if that's agreeable to everyone. Okay. It's conditional. You all have to bring an extra person with you next time. Okay, our embryo is still getting transferred down to Windsor from Toronto in the next couple of weeks. Yes, so embryo transfers, as long as the shipping company is moving them, can still occur because that's just one person in each center, and our embryologist will be here setting things up, and our tanks are ready to go, so we're good with that. Hi, I'm Sam. Hi, Sam. I'm currently 5 weeks pregnant. I am working from home, but wondering what the risks are if I contract the virus. So if you are pregnant and you get the virus, the vast majority of women are going to be perfectly fine. So first of all, if you are pregnant, you are not at a higher risk of actually getting the virus. Second of all, you're not at a higher risk of having a more complex course from the virus. Thirdly, if, and this is an if, but if you develop pneumonia, that pneumonia will be more severe than if you were not pregnant. Now at 5 weeks, it's not a big deal, but subsequently it could be. There is some rumor milling about that if you are infected enough or severely infected enough from the virus, that it may cause preterm labor, delivery of your baby before it's due. There is a rational theory behind this, and the rational theory behind it is that if you have a huge amount of inflammation, fever, stress in your body, and you are, for example, God forbid, intubated, we know that those patients are higher risk for delivering earlier. So just getting the virus is not going to put you into preterm labor, but if you get it and you get sick from it in terms of needing hospitalization, needing intensive care, yes, you would be at a higher risk of having preterm labor. So sequester at home, stay safe. Try and eat at home, try cook at home. Don't go near crowded places, guys. Hand sanitizing, hand washing, cleanliness. And all of those of you that know me well know I'm a religious guy, so I'm just going to come out and say it, and I'm going to post it later. Pray. Everybody should be praying. It doesn't matter what God you believe in or what religion you believe in. We all need some prayer right now, so pray, because that's probably going to help all of us a lot as well. Not in terms of washing your hands, you still need to wash your hands, but we all need some prayer to help us through this. This is a life-changing event for the whole globe. Okay. Will I be running my office as usual with scheduled appointments? We are trying to move as many scheduled. Your battery is dying on your computer. You might want to make sure it's plugged in. Oh, we'll check down there and make sure it is, because it's saying it's not. Your battery light is flashing either on your camera or on this. On the camera?
On the camera.
Uh-oh. Are we going to die?
Yeah.
Can we switch to this one?
Yeah.
Okay,
Yeah,
all right. If we lose you guys, it's because this is going on forever and we may need to switch over to the computer. We'll come back, okay? We're gonna keep appointments, but we're gonna try and move as many to video and telephone as we possibly can, okay? Can we switch without shutting everything off? Can we just switch the camera? We may lose Instagram, YouTube, and Twitter, guys. If
can't.
You can't, okay. So when it nixes us, because the camera runs out of battery, we will go from there. You don't have an extra, eh?
Take it all off.
Oh, take the whole thing off. Oh, okay. Welcome to modern tech. All right, let's answer some more YouTube questions. So I have been taking letrozole for 6 cycles now. I have been regular cycles and ovulating. How many more cycles of letrozole should I do before opting for artificial insemination or IUI? It depends on your specific history, but 6 cycles of letrozole in someone that was previously irregular is a 27.5% live birth rate. So trying longer is reasonable, but it depends on your age and how aggressive you want to be. I would generally say after 6 tries, it's appropriate to consider adding something like artificial insemination or upgrading to injectables or mixing injectables with the letrozole. So you've probably done enough, okay? And thanks for asking a non-COVID-19 question. Those are welcome too. Lots of hands up, or thumbs up, I should say. Thanks, Wendy. Thank you, Wendy. I don't know if you're watching. You're too busy working. Is fertility testing being put on hold? My husband had a semen analysis drop off this week that was canceled, so just curious if general testing is being put on hold. No, we are continuing with our general testing for now until we hear more from other people. I got an amen. I'm flipping back and forth between the two. Do you know when in April you will be receiving funding for your IUI procedures? April 1st. So April 1st we will be back up and running in Windsor and Sarnia for IUI. And Sarnia is moving to a new location. Thank you, Sarnia ladies. Carrie in particular, love you. We will be back up and running again. Will your booked C-sections be moved forward as planned? No, booked C-sections are staying where they are right now. That's a necessary procedure. Guys, give me a second. I'm getting a dry throat. So we'll continue with that. Will the hospital stop intended parents from being at the birth of their surrogate baby? Wow. Okay. That's a great question.